Hi, this is Dr. Habib. This weekend I was able to try out something that we're bringing into Next Health. It's called the TMS, the transcranial magnetic stimulator. And had the opportunity to try it out. And what was very interesting is what it's like on the receiving end. So as the probe was being positioned in my head, I could actually feel the currents on the scalp, but amazingly, my hand was twitching. That's one of the techniques that they use to figure out that they've reached the right depth in terms of stimulation. So the coils that are on that the handheld piece creates a magnetic field. When current goes through that magnetic field, it creates a current that goes through the skull into the brain tissue, and the depth is calculated based on the movement of my fingers. So you saw my hand twitching. That's basically saying that electrical signals actually got to where it needs to be. So the depth was calculated. The next is to position it in a way to actually see some improvements in clinical situation. So the simple thing to explain is that as the electrical stimulation was going through, I could feel it on the scalp. And depending on what setting you have, you feel from anywhere from a tapping to something a little bit more irritating, depending on what you're trying to achieve. And at the end of the more irritating sequence, you're left with just a mild touch of a headache. Nothing where you want to go to a medication, nothing that stops you from doing what you're doing and goes away within a few minutes. And so once the process was started, I was able to kind of really see what impact it has. So, I was feeling pretty good on Sunday, and I was in my usual cheerful self. So I said, why don't you use the one to treat the anxiety, the one to calm you down? Let's see if it really works. And so within a couple of minutes of going on the stimulator, I hadn't noticed it offhand. Then in retrospect, I was saying to myself, I actually do feel calmer because I wasn't as vocal and as lively as I was. And that impact changes once I got into my usual routine of, talking about a subject matter or getting animated. Then another sequence was if in the case of people who have low mood or depression, that stimulation was a little bit more, power, and you could feel a little bit more, and that was to engage the neurons to have them activate in a different way. And in that situation, I can't say I felt much more energetic or happy, but what I would like to say is that there is a real change that you feel right away when this stimulation, not least because you can actually have your motor function changed. That's one way to know that the electrical fields got in there. You actually feel it on the head itself. And secondly, the one that they did to calm me down, I felt like there was an edge, and that was after just one quick session of a 2-minute session. And so I think this TMS is the real deal. And there's an abundance of data already out there. It's FDA approved already for depression. But the thing that's amazing is that just by stimulating the brain and helping the brain increase the blood flow, which in turn improves the flow of the CSF, the cerebrospinal fluid, the brain can heal itself. So whether you have a low memory or executive function, the processing isn't that great, or you are low mood or depressed or anxious, or whether you've had injury from a stroke, anything that increases the stimulation leading to blood flow and increased CSF movement can only allow the brain to heal itself. And the amazing studies that are coming out about vagal nerve stimulation and how it impacts the immune system indirectly through other organ systems is just amazing. And that's why when we talk about the brain and the gut, the brain being the number one brain, the gut being the second brain, this is actually turning out to be confirmed by studies. And so over time, I will go over more and more of these scenarios. My ultimate goal is to use the brain as one of the healing tools And in addition to all the other systems that we use and the protocols that we have, I want to engage the brain in optimizing the immune system. I want to engage the brain to make the brain more functional. As you can tell, that is also a big field of interest in terms of dementia and Alzheimer's. And post-stroke, the recovery, if it's not good after the first few days or a week or month, definitely by a year, it really isn't looking good. So there's a lot of hope, and I got the first taste of it. I look forward to engaging and sharing more of these outcomes with you.